We're good to go.
Hello, everyone. Thank you so much for joining us. I am so excited to be here today and talk about something that is just so extraordinary. I never thought I would be practicing medicine in this time, and that is everyone is losing weight. This is absolutely crazy. I often say, my staff know this, that I'm so excited to be practicing medicine in this day and age because there are just so many exciting things happening, research breakthroughs, technology, even AI for some things. But this has just exceeded my expectations. I feel like almost every patient I have coming in has just recently lost weight. And it's a positive thing. Losing weight and finding, especially if someone was obese or overweight, is just such a wonderful thing to do for yourself and has so many health benefits. However, the only bad thing about losing weight is the effect it can have on our skin, saggy skin, our face looking older, etc. So we're going to talk about that today. So, so we're talking about the GLP-1 effects and other weight loss drugs also, of course, apply to this. So, as mentioned, these medications are so positive, they've really transformed weight loss. And so in the literature, we're seeing this called medical weight loss, MWL, just FYI. You might see that if you're doing a deep dive on some medical literature. But as this is happening, we're also noticing some other things. Facial volume loss. And when the volume goes away, the skin starts sagging. When the volume goes away, we have loose or crepey skin. We even have changes in skin quality, and patients come in and they say, I feel like I'm looking tired, even though I feel like $1,000,000. So this can be a real bummer because it is such a triumph to have weight loss, and then to feel like you look worse in spite of that is can really be discouraging. So we see this in the news, right? We see this on social media. These even celebrities who have whole teams um, kind of advising them and telling them what to do, they look awful. And one just wonders, why isn't someone saying you need to address this? So we hear this term Ozempic face, and we don't want it to apply to ourselves. So we talked about reduced fat volume. So when we lose fat, it's a positive thing everywhere in the body except the face. Our facial fat pads are very important to us. They keep the skin elevated where it should be. So we've got these beautiful fat pads and they provide contour to our face. So even if you look at this previous picture, you can see the really nice contour in 2024 versus on the right, he's just like, well, he's looking skeletal then, but uh, a lot of people just kind of look like they have no contour. For instance, like when you put on makeup, like blush to accentuate the apples of your cheeks, you want a little fullness in the inner part or the medial part of the cheek. And when you start to lose the facial fat pads, you lose some of that. So we want the fat in our face, or we want something there to provide contour, our beautiful contour that's normal and youthful. Um, a lot of talk has been had about reduced muscle mass. The caloric restriction with the GLP-1s has been so severe that a lot of times we lose muscle as a side effect. And so, of course, there are lots of medical things to talk about there, but cosmetically, we're seeing a decrease in tone of our muscle. And then we get kind of skinny fat, and we don't want that, of course. With the loss of fat, we see loose skin. So we're seeing loose skin, we're seeing crepey skin. The loose skin is not contracting, so that can really bother patients. And then also, it's kind of counterintuitive, but with weight loss, it doesn't all necessarily go away. There can still be pockets of stubborn fat, or maybe someone just wants to go on a 10-pound journey, not necessarily looking skeletal. And so if they're going on a weight loss journey that's smaller, like 10 pounds, they may still have areas of fat that's stubborn and prohibiting them from achieving their cosmetic goals for their body. So, again, we don't want this Ozempic face. We want to replace the lost fat. We want to work on the collagen, and we want to kind of decrease the rate of shrinking. If someone loses weight really fast, that's when we can really see a huge change in their facial features. And that can be a dead giveaway that someone's on these weight loss drugs. And like I mentioned, it's not necessarily the most flattering look. So we're hearing all of this in clinic when patients come in. And something that's really interesting that I've talked to about my colleagues is um, a lot of patients are saying, and you might notice this too in friends who have had this weight loss, my skin looks dull and their skin just doesn't have the luminosity and the brilliance that they're used to. And that's interesting. It's not well studied yet, but I suspect that we're going to learn more about why that is. But in general, just everything's kind of looking a little bit yuckier if, on the face. Body looks great. Face just may not look quite as good as what someone is hoping for. But remember, this is all a good thing, and we can do things to address these changes. So if you need to lose weight, please don't be afraid to lose weight if medically appropriate. I encourage you to follow the guidance of a medical doctor while you're doing this. And we can address the secondary effects very easily in clinic. You're going to see this today with someone who's lost over 70 pounds. So, um, we put this in the slide because this is such a hot topic. The company Allergan asked me to do a webinar on actually cool sculpting, which is a technology that shrinks fat, but cool sculpting in this population in patients who have lost a bunch of weight. So again, it just goes to show that we are seeing trends that even though people are losing weight, there's still cosmetic needs, even cosmetic needs for additional fat reduction. So part of this is because the fat distribution changes. And then we talked about muscle mass. Muscle mass often shrinks with this caloric reduction and resulting weight loss. And then the skin elasticity changes too. So we can address all of these actually very easily in the clinic. So let's look at some recent data on this. You know that in our office, we are very data driven and we believe in science. And so here's some recent publications regarding this topic. So the first was just published in June of 2026. So this was just hot off the press from last month. And this is a really useful article, actually, because it tells us, yes, when patients have lost a lot of weight due to these medications, of course, they're losing fat and they're losing fat in the face. But we can see from this article that patients are losing more fat in the superficial fat pads. So it's a little counterintuitive. So it's tempting to go in and replace all the structure. But this paper is telling us that's not the entire story. We want to, of course, replace the structure in the deep plane when we're injecting, but we also want to treat the superficial plane. And so this article really reinforces what we've been doing here at Clear Dermatology and Clinic, which is using a combination approach in patients who have had a lot of weight loss. So in our office, we often treat the deep plane and the deep fat pads, but also we layer the products, often using something that stimulates your own collagen, what we call a biostimulator, such as the product Sculptra Radiesse. And so we can layer these products so we treat the deep fat pads and the superficial fat pads and address both of these. And so we talked about the flattening of the cheeks earlier, but also the more pronounced facial transitions. That was one thing this paper noticed. And again, it's not really rocket science because this is what I'm hearing every day from patients. We're seeing the transition from here look a little harsh. We're seeing the transition here looking a little harsh. But again, we love science. This is objective proof that these are the areas that need to be addressed. And this helps us determine the most effective ways to address them. Um, so when we talk about the superficial and deep fat pads, we're often talking about what we call in cosmetic dermatology the mid face. So that's what you would think of as the apples of the cheeks extending out to the cheekbones. And so again, this tends to be the most effective area because of these fat compartments there. And you notice if this suddenly deflates, those transitions appear harsher here and here. So it makes sense. And again, helps us prioritize. If someone comes in and they want to focus on one thing or they have a limited budget and we want to start with their priority, a lot of times we are going to start with their mid face because this paper suggests, and what we've seen in clinical practice as well, this will be most efficient and it's the most important area to treat. Here's another paper also published in 2026 from the Journal of Clinical and Aesthetic Dermatology. And so, again, not super earth-shattering here, but it's great to have the research. And it's showing that collagen stimulators, such as Radiesse and Sculptra, are really, really impactful in these patients who have lost a lot of weight. The hyaluronic acid fillers, so things like Juvederm, Restylane, and and RHA and those families of products restore facial volume strategically after the weight stabilizes. And then using the energy-based devices such as laser, ultrasound like SoftWave, radio frequency like Agnes, that helps the crepiness of the skin, the decreased elasticity, and what we call the laxity, or of course the saggy skin that happens after weight loss. So this paper also suggested that the timing of the treatment should be throughout their weight loss journey, not just at the end of it. So 2024-ish, when a lot of patients were coming in, they would come in and say, "Oh, I'm just starting a GLP. I want to lose a lot of weight. I'm going to come back after I lose the weight and then we'll fix my face." Well, this paper actually suggested, and again, it kind of makes intuitive sense, but it suggested that the most effective way to improve the cosmetic outcomes of weight loss is actually to treat as we go. So to treat as we are losing the weight, and that's going to keep the patient happier and quite possibly improve the overall cosmetic effect. Although I think that needs to be studied more. So, this is a paper, and it is back from 2024, but I thought this was interesting because they actually quantified how old that someone looked after weight loss. So, and again, it's kind of intuitive, but this is proven now. Greater weight loss is associated with a greater increase in fa perceived facial age, how old that you look. So, patients with a lot of weight loss appeared at least 5 years older and patients with a little bit of weight loss um, appeared like they aged 1.2 years, that they were older than their chronological age. Of course, everyone who leaves this office, I want looking younger than their chronological age. So that's a huge shift, and that's something that we want to shift towards the younger years. So again, it just speaks to the importance of treating as you're losing weight, and we can prevent these aesthetic outcomes. We can keep you looking great and feeling great about yourself and your weight loss journey because it is such a triumph, like I mentioned earlier, to be able to lose this weight. Again, this paper did show that the most common facial changes were the deepened, what we call the nasolabial fold. So this is what the previous paper referred to as a transition area. So when you lose weight, these guys really deepen. And then the midface comes down. And then what was not mentioned previously was the laxity in the neck. So right here in the center, what they're calling the central neck there's a lot of skin laxity, which it makes sense because as things come down, they don't just stop at the face, they kind of settle here in the neck. So if we put a little bit of facial structure back in, it's actually going to lift from the neck as well. And that's really gratifying when it does that. All right. Final paper that we threw in here, and I thought this was so cool. So this was a paper again from 2024 Plastic Surgery Journal, and this was after bariatric weight loss. So this is not medical weight loss, but it is bariatric weight loss. However, it's the only histological study that I've seen um, recently done. And so what happened was these patients were undergoing weight loss surgically, and they had a biopsy taken of their skin before the surgery and then 1 year after the surgery when they've had all this weight loss. And even just during that first year, they found a lot of aging. So they found reduced collagen density and organization of the collagen that can make the skin look age and dull. They found disruption of the elastic fibers, and that makes the skin less elastic. They found changes in what we call the dermal extracellular matrix, which again makes the skin look dull and unhealthy and have less structural support. And so these microscopic changes after just 1 year of surgical weight loss are significant. And I would love to see a study like this before and after medical weight loss. So hopefully somebody's working on that. So anyway, every treatment plan is different. Everybody needs a different plan. But these papers have kind of set the framework with how we should approach these issues after weight loss. So we know that this is a real issue. We know that the issue is due to structure. And we know that treating during the weight loss is the most effective way to address this. And we can address all these things listed on the slide very easily in the office with non-invasive or minimally invasive treatments. Some people come in and they say, "Oh my gosh, just don't make my face look fat like when before I had the weight loss. That's like the last thing I want. I'd rather have a hollow face than have feel like I gained all the weight back in my face." So, one of the really cool things about tailoring these treatments is we can absolutely prevent that. And in fact, I'm usually taking a very conservative approach with these patients. So we're providing structure back, and then we're doing a minimal amount of the collagen stimulators. And the collagen stimulators are actually much less likely to make you look too heavy when done in a conservative way. So the bottom line is you do not have to worry about looking too heavy or looking completely like before you lost all the weight if we go forward with these treatments. So we've talked a little bit about this, but here are the three main tools of injectables to lift and support your skin. So we have filler, hyaluronic acid filler. That's going to provide the support and a little bit of volume. We have two what we call biostimulators. They're called Sculptra and Radiesse. Both of those things will stimulate collagen, and so they will lift your face, they will add volume, but again, they do so in a controlled way so you don't look too heavy in the face, and they can really be effective at lifting the skin from the face and the neck. Here's an example of one of my patients. She did not have medical weight loss, but she just naturally is very thin. She's an athlete. And so we started with some filler. So if you notice the middle picture, it's very subtle, very natural looking, but for her, this was extremely impactful in her day-to-day life. So we softened the area near the nose. We lifted the cheeks so she had more contour. So if you look at the left, she looks flat in the cheeks. If you look at the middle, she looks a little more contoured and lifted in the cheeks. And the lower face does not look as heavy when you go from left to middle. And so we are looking at someone who looks more youthful and younger in the middle photo. And then I said, let's add some biostimulator because that's going to do a better job of replacing some of the volume we've lost naturally over the years. And so then we put a little bit more filler and some Sculptra. And you can see I'm very conservative with my treatment approach, but look how her cheeks continue to be more contoured. She got a little bit of facial volume back look at the area around her eyes. Instead of looking hollow, it looks a lot softer. And when you look at the far left versus the far right, you can see that most of the weight in her face is on the left. On the left is on the bottom, making her face look rectangular, whereas on the right, the focus of the eye is more in the upper face, so that makes her face look more oval or even heart-shaped. And so these kind of treatments can look 100% natural, but change the shape of your face. And in real life, she was so excited about these results. This was life-changing for her. Here's another patient. This patient is this before and after is an older before and after of one of my patients, and she had lost a lot of weight on her own, and she was quite hollow. You can see those transition areas, the upper and the lower transition look quite harsh. So I put some Radiesse in her. That was the only treatment, and well, a little bit of Botox too. And you can see she got a beautiful contour back. And for her, this was both age appropriate and it was appropriate to her body size. And so she was absolutely thrilled. Another life-changing result. Here's an example of how we're enhancing both the superficial and deep fat pads after filler. So you can see the apples of her cheeks. This is, of course, taken from above. You can see how they were quite flat in the top picture. And in the after picture, with just 1 syringe per side, you can see that the contour is really beautiful and restored. So next, talking about the skin quality. Again, the skin quality dulls a little bit and we get some crepiness from the loss of volume. So we have multiple ways to treat this. In general, an energy-based device will be most effective, although the Sculptra and Radiesse, the biostimulator that are injected, will also help with this. So we're highlighting Fraxel and microneedling with this presentation. Both of these things are considered resurfacing. So it takes the surface of the skin and completely rejuvenates it. They both result in new collagen in the skin, which tightens, helps crepiness, and helps texture. And so you can see in this patient, her skin tone and texture is dramatically improved in the after picture. We left her eyes uncovered with her permission because she got a lot of tightening around her eyelids. And you can see how nice and youthful her skin looks after a single Fraxel treatment. So treating the skin tone and texture is really, really important. Because I've just recently given this webinar to doctors throughout the United States on cool sculpting in GLP-1 patients, I thought I'd throw in this cool sculpting and cool tone slide. Again, when you're losing weight, does it all go away exactly how you wanted to? So you can use cool sculpting to supplement the weight loss. So if there is a stubborn love handle or stubborn little pocket of belly fat, and in the research on this topic, we do show that the truncal body fat, so the abdominal and the flanks or love handle areas, those are the most resistant to weight loss. And so we commonly do use cool sculpting on the trunk of the body. And in all ages, races, and ethnicities to treat those stubborn areas of fat. Cool tone is something that actually contracts the muscles for you. So it's like passive contraction of your muscle, and it will strengthen and tone your muscles. So we frequently use this in combination with cool sculpting to get a really wonderful body contour. So a body shape that is really um, beautiful and youthful and desirable for the patient. So the cool tone could also help with some of the muscle wasting from weight loss. And it's so easy, you guys. I love this device. I wish I had the motivation to do it more because you just lay there and the device contracts your muscles. And it's so great for your posture, again, your body tone, and the overall contour of your body, especially if you do it on the glutes and the abdomen. Here's an example of someone who had cool sculpting on the abdomen. So you can see that dramatic improvement of that stubborn fat. You can see this person's like in shape. They just had that extra fat there. So now they've got beautiful silhouette and some ab definition there. Here's cool tone. So this is no cool sculpting, just cool tone. So after 4 treatments here, you can see the ab definition and a little bit of a contraction of the waist. So it can really help with the contour of the body. Here's a male patient. He had 20 treatments, but look at the difference in his contour. And again, especially for males, this tends to be like a really stubborn area. And you can see his posture is better too. And a lot of patients say that even before they're noticing visible results, they're noticing that they're playing golf better, they're happier with their posture, they have more endurance in their day-to-day life from toning these postural muscles. We talked about timing. We should really be training as we go. And we have been treating patients with weight loss for several years now. So we do kind of have an idea of the rate with which we should go. Regarding body contouring, I actually, in my most recent webinar, said, if someone's losing 100 pounds, it's probably best to wait until the body weight has stabilized and then do your body contouring with the cool sculpting or cool tone. But again, that's flexible and we'd love to help you with that treatment option. Um, okay, so this is a lot of information and it can be kind of overwhelming too. But I want to tell you and reassure you that not everyone needs every treatment mentioned. And so, one of my jobs as your physician is to have you come in and let's talk about a plan. And we might change the plan as we go, but I can help you sort of weed out the things that are not going to be as helpful or cost effective and help us prioritize and focus on the things that will be. So, I really encourage you to come in and have a consultation with one of us and we will help you come up with a really targeted treatment plan. So, in summary, here are some of the things we talked about today. And I really, really want you to look your best after weight loss so you can celebrate the wins instead of feeling self-conscious about looking older. So you really want to celebrate this. And then know that the changes in your face, skin, and body shape are common and normal and expected. And we can do things about this. So we want to help you create a personalized treatment plan just for you that will focus on your priorities. So here are your specials that we've created for you today. There's 4 of them today. So here's the first package. Um, you are going to get 2 syringes of hyaluronic acid filler like the Juvederm that we're doing today. You can also use Restylane or Redensity from the other brands. We're excluding Voluma or Volux from this promo. And then you're going to get, so these 2 things will help with the structure. It's going to help with the deep layer. And then you're going to get a vial of Sculptra that will help with the more superficial layer. So this is a layered approach addressing the most common concerns of weight loss. And also we know from the literature that this is the most efficient way to use your resources to rebuild the face after weight loss. So the price of this is $2,700 normally in clinic, and your webinar price is $2,100 for a savings of $600. Again, this is going to help hollow cheeks, it's going to help flatten cheeks, it's going to help hollowing up here, and it's going to help just everything kind of deflating. You're going to get instant gratification from this, and you're also going to get gradual improvement over 6 to 9 months with the Sculptra. So I love this package because it's a little bit of everything. Okay, package 2. So this is a little bit more. So you're going to get 1 syringe of filler, 1 Sculptra, and then you're going to get Fraxel to address the crepiness of the skin, the tone and texture of the skin. So I love this, and this is kind of a surprise. We usually only do a Fraxel promo once a year, and patients have been asking me recently when we're going to have a Fraxel promo, and I keep telling them it's probably coming in the fall, but here you go, Christmas in July. So, so this is a really good package. You're saving $600 on here. We can do all these treatments in one day too. So again, you're getting instant gratification. Downtime from the Fraxel is a week. So you do want to plan that into your schedule, but within a week, you're going to be feeling like $1,000,000 because your skin's going to be glowing. You're going to have some lift, and then you're going to have 6 to 9 months after that of continuous improvement. So I love this. Again, you're saving $600. The third package is related to the cool sculpting and cool tone. So basically, we have different models depending on what area you're treating. So if you can treat the arms, you can treat the abdomen, you can treat the flanks. And then if you decide to treat both the abdomen and the flanks, you get a discount on top of that. So we're happy to provide you more information on the pricing, but the pricing is kind of staggered based upon body area treated. However, if you decide to purchase a cool sculpting package, we will give you 6 complimentary cool tone sessions, meaning the muscle contraction session. And that will definitely help your body to become better contoured. It's going to help your muscle strength. And some people even think it helps speed up and get a better result from the cool sculpting. Though I think results on that are pending. Um, but this is a really great savings of $1,200 for 6 of these complimentary cool tone sessions. And finally, based on your feedback, thank you very much for everyone who gave feedback to Tracy after these webinars. Some patients are like, I don't know what to choose. I always let my doctor choose for me. I would want Dr. LaTowsky to choose. So we're going to choose. I'm going to choose actually. So if you want to leave it in my hands, we do have this special package for those of you who gave that feedback. So this is valid for a curated combination of fillers, biostimulators, and devices. So in other words, it's not for your Botox for the year. It's for these specific treatments. So fillers, Sculptura Radius, and devices. But we can mix and match based on our consultation. So if you're like, I feel like I need a bunch of stuff, but I have no idea what, and I'm confused, this is the package for you. So you save $1,000 on this package, but you are committing to $4,000 and you are getting $5,000 worth of treatments based on our consultation and what we mutually agree upon. So I actually love this. And again, this is based on your feedback, and I think this is such a great opportunity. Um, so thank you so much for attending. We are going to have a demo now. So we're going to do Sculptra and Juvederm filler in someone who has lost 70 pounds of weight. So basically that package number 1, that is what we're doing for our model today. Excuse me. I am going to pause. We're going to pause the webinar. This may take a little bit of time, so you're welcome to watch for a little bit and then go ahead and pop off. These promos are good for the rest of the today and tomorrow, so you have 2 days to think about it and commit. We can't give you longer than that because it's such a good deal. And we just don't have the margins to do a lot of these promos. And let's see what else. Oh, we're also going to be doing a question and answer session while I'm injecting. So stay tuned just 1 second and we'll be right back. when. Go ahead. Hi guys, we're back. Hi. So this is Christy. Christy is actually new to our practice today, and she's my wonderful assistant's mom. So yay. She's getting some serious daughter points for this today,
Yes,
right?
she is.
And so Christy, how much weight have you lost?
About 70 pounds.
I feel like guys believe that. It's amazing.
Thank you.
Great. And
Yes.
your face is not even super gaunt, but you probably feel like
Yeah, well, you just, you lose the weight, you do all the things with exercise, and then it's like you kind of go, oh, why do I look so old?
that's exactly it. Exactly. So, if the camera wants to come and just take a look, is that okay if we take a look and talk first? Okay. So, the kind of real life, like an in-person consult here. So we're looking at Christie's. Here's what we're calling those transition phase or transition areas. So as she's lost weight, this part goes down and she's had some flattening of her cheeks. And then this area that where the nasolabial folds look a little bit, probably more than what you're used to, more than what you used to have. And then it's not really bad at all considering it's been 70 pounds, but this is another area where people really notice that it looks a little harsher after weight loss. Also, we were talking a little bit off camera. Your temples are actually doing a-okay. So a lot of people do get what we call temple wasting or hollow temples. That can be very aging. But Chrissy's temples are actually great. I don't know how you did that, but that's pretty cool. So she's got great genetics and beautiful face, obviously. So she's had some previous lip filler, but it's been like a long time since she's had any other filler. You're saying like 8 or 9 years ago?
Yeah, probably at least maybe 10, and I only did a little bit here.
The cheekbones?
Yeah.
Okay.
Which, yeah, so.
So today will actually be the first time you've ever treated kind of the middle face.
Yeah.
Okay, awesome. You're gonna love it. So I'm gonna give you a little ice. So, like we talked about, we're going to use a filler to provide structure first. And then we'll use what's called a biostimulator, that's Sculptra. That Sculptra, it's like a magic potion to cause your body to create collagen. When it happens, it lifts. It's going to lift from your lower face and put it back into the upper face where your skin belongs. Perfect. Love it. Keep your eyes closed for me, please. And I'm just going to inject a little bit of lidocaine here. Here's a little lidocaine to help us. Actually, take the other one. Help us get started here. This will make it super easy for you. There we go. And I'm happy to turn a little bit away from your natural. So I'm gonna ice a little bit, and I'm gonna do another lidocaine injection. And so while I'm doing these lidocaine injections, which are really for the Sculptra, are there any questions from the audience that we can answer?
Want me to read them to you?
Yes, please.
After a significant weight loss, cool sculpting can leave extra skin in the abdomen. What can be done about that other than removing the extra skin?
So, okay, there's a couple things I want to talk about. Great question, by the way. Thank you so much for submitting that. So I'm going to do the same on the side. So, cool sculpting actually can, they don't like to advertise it, but it does tighten the skin just a teeny tiny bit in proportion to the amount of fat that is lost from the cool sculpting. So if that makes sense. So typically, if someone is doing cool sculpting only and not having weight loss, it typically does not add crepey skin to the area. That can vary a little bit. It's hard to make a blanket statement about that, but in general, that's what we see. Now, if you have weight loss, then you do some cool sculpting. Yes, you're seeing that lax skin and that crepey skin. And we have some options for that. My first choice, and actually something I'm hoping to have done for myself today, is actually injecting a little bit of Sculptra. So the same product I'm going to put in Chrissy's beautiful face today. Same product, I'm going to inject it with a different technique into the abdomen. And what that does actually, when injected in a special way on the body, it will not volumize, it will actually tighten because of that new collagen, and it will help with the crepey skin. So that would be my first choice. Second choice, and actually ideally combined, because tightening loose skin on the body is hard without surgery. And so always a combination treatment is the best treatment. And so blood pressure, see, what I love to recommend is also combining that with radio frequency or ultrasound, and you can do them at the same time, or you can try one and then after that you can do another. And what happens is the radio frequency and ultrasound will tighten the skin, and it will use a different mechanism of action than the Sculptra. So you get the benefit of two modalities using two different mechanisms of action, and then the results are synergistic rather than just additive. So it'll be better than doing either one alone.
For package 3, where can I find all your cool sculpting package options, please?
Yay. Okay, we will email you in fact, let's include that in the post-webinar email. We are going to include that in the post-webinar email. Thank you so much for asking that, because it is something that it's not super easy to talk about because I don't even have the prices memorized. And if you want to ask when you call the office too, all of our front desk staff, especially our cosmetic coordinators, have the pricing. So we have a list that makes it really easy, and it's separated by how many treatments you want and the body area. Okay, guys, before we go to the next question, I'm doing this Juvederm right now. And Chrissy's being awesome. It's the first time she's had Juvederm in this area. And it is in a strategic place to lift the mid-face. And then I'm also, sorry, Christy, if I relax just a little bit. I'm also adding just a little bit to her superficial fat pads here as well. Great job. How you doing? Yeah. Okay, great. So this is the structural, and this is instant gratification. So she will see these results when she goes home today. And it's pretty cool. And when you wake up tomorrow, you're going to feel like you just look 5 years younger. Sure. So if the camera wants to come in and take a closer look, you can see those results from one side to the other. In the audience see what okay, how's it look? Just kidding.
How does it look?
Okay, now what I'm going to do is I'm going to go in with the Sculptra. So Chrissy, this is like, so the previous was a gel and you felt it was thick here. And by the way, your lip might be getting numb. That's completely normal and expected. And I did not treat your lips, although we could have fun with that too another time. But this will be, the Sculptra will be kind of like a watery material, and it has lidocaine in it. So again, you'll be getting numb as we go. Shouldn't be too sensitive at this point. So turn away from me. Right. And now, again, this is a Sculptra. I'm going to use it to treat the superficial fat pads here. I'm going to address some of the deeper ones as well. Great job. How you doing? Okay. Not too bad? No? Okay. Great. Now, take the highlight, please, and have your book pressure here. Pressure. Okay. Now, light. Pressure. Great job. And to the audience, kind of looks a little worse than it feels. Sorry to say that in front of you, Christy.
I can't see it, so.
Okay, good. And how does it feel? Does it feel okay? Okay, okay, good. And then this area, you'll feel a little pressure. You can feel the collagen back here. Good job. Amazing. So this is going to really pull back. This will help. This angle will help her neck too, like I mentioned before. That poor skin is just falling down onto the neck, and who doesn't want a little bit of a neck lift? Tiny bit, not like a surgery, but just a little bit more definition in that area. Awesome. Okay, other questions?
Somebody else asked if cool tone or cool sculpting will help with cellulite.
Okay, so technically, I don't think those two things are the best things for cellulite. I think doing the Sculptra is actually better for cellulite, but whenever you do build up muscle, the cellulite automatically looks better because the skin is tighter. So in an indirect way, the cool tone will help with cellulite, but if cellulite is your main concern, I'd rather see you in person for a consult, and we'll talk about doing Sculptra to the area.
Lots of people wanting to hear about the cool sculpting, but
Yeah, okay, what else? The pricing or?
the pricing, a lot of it, so we'll send it out.
We'll send the pricing out. You guys, cool sculpting it's really amazing. And I know you've heard me probably talk about this before, but I first became involved with cool sculpting back in 2009. Okay, so this technology has been around for a while. Back in 2009, they were doing their initial studies for FDA approval. So what's great about that is that we know everything there is to know about this technology. Maybe not everything, but a lot. And so we know how to use it. Things have evolved over time, so we know how to get the most effective results. And we know the best candidates for this treatment. So it's really a treatment that's been tried and true, and we know that it works. In fact, each session with the cool sculpting will result in 20 to 25% fat reduction. And on this webinar I just did on last week, a week ago actually, I was saying to these doctors on the webinar, when I first was helping with their trial as a sub-investigator in 2009, I was thinking to myself, this is too good to be true. Because at the time, the gold standard was liposuction or just surgery. And so I was saying, there is just no way this technology is going to work. How can there be something without even a needle involved that will actually reduce fat? But I was sure wrong. I was completely wrong on that. So it really does work, and it's very, very, very safe and effective. Okay, let me take a look at you. Beautiful. Just need a little bit of lift. Oh my gosh. Yes. Yes, you're doing great. You feel okay?
Yep.
Okay, awesome. Okay, turn away from me. And nice, this area right here.
Somebody else asked, I have crepey skin after the GLP-1. It really bothers me, and I have jelly belly after abdominal surgery and weight loss. Any suggestions?
Oh my gosh, I'm just stuck on jelly belly. I love that. Thank you for that wonderful analogy. Okay, reread the question because I just started giggling over the jelly belly.
So she's done GLP-1s,
Yes.
and she's got some crepey skin around her abdominal area. She had surgery and then weight loss. She's asking if there's any suggestions for that particular area.
Yes, I would love to see you do a combination of Sculptra and Soft Wave. I think that's going to really get you the results you're looking for, and it doesn't sound like you need much. Okay, my dear, so you will feel this a little tiny bit. I'm just going to give you some lift in the upper face. Good job. Sorry. Here we go.
It's like uncomfortable, but it's not painful.
Oh, good. Okay.
It's like, well, it just feels weird.
Feels
It
weird. I
doesn't
know.
really hurt.
That's really like the best description of it. It just feels really weird.
It's not painful.
There we go. So just a little anchor point to lift. Okay, guys. So if you could get a little closer and show us one side to the other. Now, for the audience at home, she is puffy and she's got extra lidocaine. So this is a little bit more volume than what she'll have, but this is kind of like a little, yeah, she's getting a little, you're getting a little puffy here, but you can see one side to the other, you can see that the left side looks a lot younger than the right side. Yes. Okay, and she's not too. I can tell this on camera. Yes. Okay, so pressure on this side. And I'm gonna go ahead and do the other side. Are you okay, Christy, doing it on camera? Or you want a little break?
Oh, I'm fine.
You're fine?
Yeah.
Okay. Cool. So you guys can pop off. I'm just gonna do the other side just because we have to do it anyway. So we might as well finish up over here. And this is fantastic. She's doing great. But if you guys have to go, no problem. If not, I'm gonna do more questions. Let me hear another question.
That's all the questions we have, but
Does anybody else have any questions? I'd encourage you to write them in. Otherwise, I'm just gonna talk. Okay, so here we go. On the other side, this is a hyaluronic acid filler. Just remember, you're not quite as numb over here yet, but you will be. So just a little pressure in there, that's normal. And you're gonna get numb here in a minute. Great. So my assistants are expert tappers. They tap to distract you. And Carly over here, she got called a woodpecker the other day. It was so funny. I don't think, she was focusing on her job. So I don't think it registered right away. She was kind of like, why is this person calling me a woodpecker? And it was so cute. I love that analogy. Okay, guys, I am filling her superficial fat pads right now, and I can literally see it inflating like right in front of me. Did you see that?
Mhm.
Yeah, it's just so cool. So you're gonna move this. Good job. This part is just weird, and it makes your lips go numb. So sometimes patients are like, "Why is that happening?" And are you working on my lips? Like, no, I promise. We didn't talk about that. We're not gonna do it. Okay, so I will take this. And Carly, on your side, can you make sure all the skin markers off before we do the spinal DNA? Okay. So come over to, now we're switching to Sculptra. Okay. It's gonna be so good. You're gonna get such a nice lift. So again, superficial fat pad. Weird to think of a fat pad as being a good thing. Like total paradigm shift. But in this case it is. Job. Good. Okay. Great. With some pressure over here. We've got so many people working on you. Great. Thank you. Here is if I'm working with your other established collagen here. Great. So the Sculptra is fluid, and the fluid goes away over the next few days. And then it actually builds back up over the course of like 6 to 9 months. And so it's really great for a nice gradual change of like weight loss. People will just be like, you're kind of used to this from when you've had your weight loss. Are you losing weight? Are you something you're doing is making you look great? That's kind of how the Sculptra is, or they'll compliment your hair or your jewelry, like earrings, or they won't be quite able to put their finger on. Great.
Someone else asked, what do you suggest for crepiness in the arm area? They said batwing arms.
Yes, batwing
I need
arms.
to know that too.
Yeah. Again, I don't want to sound like so monotonous, but batwing arms are perfect for Sculptra. I've just had mine done. You can tell I'm a believer. Just had mine done like a couple months ago. And what happens is it actually, because of the new collagen, it actually tightens the skin. And some people are like, I don't want to make my arms bigger. I want to make them smaller and I don't need to do injections in them. But it's been shown that when you produce new collagen in that area, it actually shrinks the circumference of the arms because the arms are getting tighter. So instead of being like stretched out and hanging, the arms are tighter and the circumference is less. So highly, highly, highly recommend Sculptra. I've done it for men and women in that area. High satisfaction rate. Okay, Christy, how are you feeling?
Good.
Beautiful. Awesome. Not quite as, the left is a little more puffier than the right, but that's okay. Every side is different. Oh, this is so good. Okay, let's get a close-up of this wonderful, beautiful model. And I'm going to hand you the mirror. Look. And you can see, wow, isn't that nice?
That is nice.
You used to look. So softer in this area, softer here. Look at these beautiful cheeks. Lifted, lifted, smoother here, smoother here. And then this is a little puffier than the end result, but you can see it's going to provide structure. Look how beautiful your jawline is. And these marionettes are a lot smoother.
Yeah, very much. Fantastic.
Hey, great job.
Yay.
Thanks for being our model today.
Thanks for having me be your model.
Of course. Thanks everybody for tuning in. I'll see you next time.